What's up, everybody? Dr. Shadi Ireifej here, representing Vet Triage. We are currently live. We hang out here a little bit in the West Coast heat. I thought today we would tree frogs, holla. If you guys follow my Instagram, Dr. Shadi Ireifej, and follow Vet Triage, you'll notice that we made it to Martha Stewart's magazine. Pretty big deal. And we're super proud of that article. Thanks, Martha Stewart, if you're watching. But be prepared to see more media coverage on us. What's up, Tiger and Mama's IG Adventures? So we're super proud of that article for Martha Stewart. Very exciting stuff. So that's pretty cool. And again, you'll see us more in the media as time goes on, because Vet Triage is going to be huge. We're spearheading the movement for veterinary telemedicine. We're really helping out a lot of people and their pets. So we figured we would talk today about heat stroke, specifically in dogs. That's where we tend to really see it. But I guess any species can get it. So feel free to ask any questions that you'd like about anything, I guess, but preferably veterinary medicine, ideally. Baby. So, heat stroke. Okay, so heat stroke. So there's two different types, or categories rather, of heat stroke, depending on the cause. We differentiate them between classic or environmental heat stroke, which is the heat stroke you most commonly think of, where you just overheat from being outside in the hot weather. So that's classical or environmental. And then the second type is physical or exertional, and that's when you get heat stroke from becoming too active. So an elevated temperature in dogs is something over like 102.5, but some dogs you run a little high normally, like 103, 103.5. And I'm sure there are pet parents out there that have dogs that run even higher than that normally. So just be aware of that. But most of the time we consider hyperthermia, which is high body temperature, to be above like 102.5, 103. And by the way, hyperthermia is different than having a fever. So having a fever, febrility, is when a portion of your brain called the hypothalamus, which controls the temperature in your body, resets because of disease. You have infection or something like that, inflammation, cancer, and that's what having a fever is. Hyperthermia is when your body temperature goes up, irrelevant of what the hypothalamus is thinking. So just be aware of that as well. Though grown 9, what's up, brother? Just put my James Bond film to pause to watch your live. You are awesome, man. Thank you so much for the support. You're always a huge fan. Thank you. Yeah, James Bond can wait. Let's talk about heat stroke. So there's two types of heat stroke: environmental or classical, and then physical or exertional. So we usually see the classical one, right? And signs include things like heavy panting, fast heart rate, fast breathing, weakness. They can have seizures from this. Of course, they're rapidly dehydrated or hypovolemic. And it's obvious because they were fine 1 minute, and next minute they were in the hot weather for too long without adequate hydration, and they end up getting sick immediately. And it goes very, very quickly with these dogs. The problem with heat stroke is that time is of the essence with them, but you also don't want to necessarily diagnose and treat yourself unless you have the direction of a veterinarian. So it is one of those things that can lead to multi-organ failure if it's not caught fast enough. Thank you, though, Rogan 9. Thank you, man. It's awesome. It can cause heat stroke. When you get heat stroke, you get multi-organ failure. Most commonly the kidneys. However, you can also have hematologic abnormalities, so red blood cell issues, as well as bleeding disorders, especially DIC, disseminated intravascular coagulopathy. And so when you have these things, these abnormalities, it also does affect the prognosis too for dogs. So dogs that have these problems are less likely to survive heat stroke than those that don't. And there are other parameters too that you can look at. The morphology of red blood cells can affect it. The abnormalities in glucose, low glucose, can affect prognosis as well negatively. So there are the other parameters which your veterinarian will know about. So do you cool them down with water or temperature? MLB_17. So the treatment for heat stroke, first of all, is based on diagnosis, right? You want to make sure that their high temperature is from a heat stroke scenario, not necessarily like infection, inflammation, cancer, other problems. So if the history fits, where you have a dog that was normal 1 minute and then all of a sudden becomes overheated the next, first thing you want to do before you treat them is get a temperature on them. So check a temperature on your dogs. You can do most accurately is rectal temperature. And to confirm it, if you can't get a rectal on them, then you can try axillary, which is under the armpit. Add a degree or two to the thermometer measurement from the armpit measurement, and that'll approximate how much it is for a rectal temperature. The infrared temperatures are not that great. There are studies that show that it's not as accurate, and I've known through working 14 years of this, as well as with vet triage, that the infrared ones, the temporal ones, where you put them from the forehead or the nose, over the bridge of the nose, are fairly inaccurate. So to answer your question, the next step once you diagnose it is to cool them down. The reason why I want it done under the direction of a veterinarian, or at least confirm that they have heat stroke, is because you can overshoot the temperatures. You don't want to cool them off too aggressively because they will become hypothermic. Sage El Presidente, if on a hike and recognizing signs or symptoms, what do you do? So confirm the diagnosis, followed by starting to cool them. There are different ways you can cool animals, and again, the reason why I want a thermometer available is so you don't overshoot the correction. So what we're going to do is cool them. You can do a couple of ways. You can take cold washcloths and put it on their bodies. They're especially sensitive if you put it on their paw pads. That really helps, and that'll help cool them down. You can also, if you have access to alcohol, like rubbing alcohol, you can put that on their paw pads too. That'll help cool them down as well. If you really are stuck in the middle of nowhere and all you have is like cold water, then any kind of cold shower will also help cool them down. And you want to monitor their temperature. In the clinical setting, when I have heat stroke patients, I monitor their temperature closely. When I start hitting about 103.5 to 103.8, let's say, it varies, then I stop cooling them, because then the body's going to correct from there. You don't want to cool them down to normal temperature of 102.5 then stop, because they will keep going. They'll get colder. So you want to stop it around the upper 103s, 103.5, under 104. So 103.5 to 104, stop cooling them, take everything off of them, dry off their pads, and then that's where you stop treating them. At that point, though, it's not enough just to cool them off like that, because we don't know, right? We don't know how bad their organs are affected. We don't know how long they've been in heat stroke for. Every pet's different. So after that, you're going to want to go to the veterinarian. At some point, you have to go to the vet for follow-through. However, if you're stuck in a situation where you have no veterinarian in your community, you're too far away or in a remote area, then vettriage.com, VETTRIAGE, is an example of a veterinary telemedicine service that you can call to help direct your diagnosis and your remedies for heat stroke. So it can be done in a controlled setting, even if you're out in the wild, as long as you have some kind of cell service or internet service, vettriage.com. Otherwise, cool them down the way I described. If you're sure of the diagnosis, ideally with a thermometer. If not, and you strongly suspect it, cool them down, but it's going to be a little risky, because if you don't have a thermometer to monitor how quickly you cool them off, then you could overshoot it and go the other way. So, and that's not good either. But if you're in a pinch and it's an emergency, then you have no choice. You have to work with what you've got. So Tiger and Mama's IG Adventures. What about cats when they're in the house and it's hot weather? Is it okay to put a little cool towel on them? Well, if they're in the house, ideally you'd have control over the temperature of the household, right? So it'd be nice to keep it at a cool temperature, whatever, like the 70s or something. That's the best way to control the temperature in the house, obviously. If you are in a situation where your air conditioner or whatever is broken, call your landlord, get it fixed. But otherwise, you can, if you want to, you can have like a cold towel like on the floor, or like maybe take their litter box pan without litter and put a towel in there. And if they're cold, then maybe they can they'll sit in there. You know, if they're intelligent enough to know that if they're really hot, that they'll go to a cool area if they know it exists. So, Thorgon9 sent you 2 vet websites or UK, not much advertisement on TV. All right, okay. For 24-hour services. Thank you. Perfect, thank you. Is that to Vet Triage or to my own Instagram? So to answer your question about kitty cats, that's what you do. You can lay out a cool area, and if the cat feels like they're overheating, go for it. They'll go to the cool area. If they don't want to, then they don't want to. Don't force them to do it. You know, heat stroke is meant to be a pathologic condition. It's not meant to be a scenario where you suspect they're a little bit warm and you have other options. You don't go right to normal just to treat the heat stroke, and you know, that's not what we were looking for here. Heat stroke is actually pathology. It's a disease secondary to severe, I guess you could say, heat-related trauma. So this is for those cases that you're in trouble, you've got heat stroke, and go from there. So now, how to prevent heat stroke? Well, obviously you can, let's see here. Tiger and Mama's IG Adventures, San Francisco, go San Fran. Foster fur babies, fans on, blowing over a bowl of cool water. Yep, that makes sense. That's good too. Yep. If you're in a household, you know, you have control over the temperature and you're having issues with controlling your temperature, then whatever methods of cooling you want to do, fans are good, cool towels are good. Open the window, I guess, if it's cold outside, whatever it is, you know, and that's how you control it. So prevention is the best thing, obviously. You don't want to wait till you get heat stroke and then correct it. You would like to prevent the issue. So obviously avoid hot weather, sure. This may be more of a situation with dogs that either are really heavily furred, like Alaskan breeds, Malamutes, Huskies, Samoyeds, or if you have a dog that doesn't give off heat very well, like brachycephalic dogs, so bulldogs, Cavalier King Charles Spaniels or other Spaniels. These are pugs. These are dogs that can't breathe normally anyway, and so dogs give off heat. One way is with panting through their tongue, and these dogs have problems as it is. So these are dogs that are more prone to it. So you want to avoid the hot temperatures if you can. That'd be great. That's the first step. Second step is if you're going to go hiking or whatever with your dog, or it's you know, we just passed July 4th. We're going to hit into the next few months of other barbecue holidays. You want to have plenty of water around, lots of water for them to drink out of. And it doesn't matter if it's tap water or if you guys want to get all fancy and get bottled water, whatever you want. That's good too. And so have that around to cool them off. And then, of course, you know, monitoring them, making sure that even with all those precautions that you're taking, that they're still doing okay. You don't have to check their temperature every hour when you're outside or something like that. That's purely for those dogs that don't have any access to air conditioning, fan, water. These are the situations where you just kind of monitor them. But if they're not feeling good all of a sudden and you have the right recipe for a heat stroke, then yes, get a thermometer, check out the thermometer, start treating them. Rather, contact the veterinarian and then see if they can direct you on how to treat them. And again, Vet Triage is a service that we provide that can also help with diagnosing as well as directing the treatment for that. So it's VETTRIAGE. Any other questions regarding heat stroke? Thanks everybody for joining this. This has been a lot of fun outside in this beautiful weather here. West Coast. And again, in case you guys missed it, Tree Frog shirt. There it is. I got this shirt when I was on a field trip. I think it was junior high. So I'm 39 now. I must have been, I don't know how old, 15 then. And it's still, that was back when baggy shirts were popular. That's why it fits me now. Can you imagine what it looked like in 15-year-old me weighing 130 pounds? Tiger and Mama's IG Adventures. What about when people don't put little shoe on the feet, shoes on the feet when they're walking? Yeah, so if you have, if you're in an area that's really, really hot, of course the concrete can get very hot as well, right? Great question, thank you. So you can purchase booties to put on. Sorry about that. it's so interesting because you'd think that if a dog's feet get hot, that they'll get off of the concrete, but they won't, and it'll just burn them. It's so bizarre. But and once that happens, it's very annoying to fix. It takes forever to fix those kinds of issues. So you can buy dog booties to help. You can also avoid the concrete, obviously, and stick to like grassy areas instead. Or just avoid the outside altogether when it's that hot out, and just go outside to pee and poop on a leash and then back in the house again. You kind of, it doesn't take long to burn their feet. So, but dog booties are probably the best solution that we have, other than, of course, avoiding those risk factors I mentioned. Hey, sorry guys. Thorgon 9, how much the video sessions? $50. Regardless of how long the session is, regardless of how many pets you have, doesn't matter what species you're talking about, where you're calling from, doesn't matter what time you're calling, $50 a session, and it's a real live video chat with licensed United States-based veterinarians 24/7. They're fantastic and compassionate and awesome. And there's a chance that if you go on Vet Triage, you'll also get me as well. Lucky you. No extra charge for that. So that's the deets, as the kids say, on Vet Triage. So thank you everybody for the support, for joining this. We'll end it now. Heatstroke. Yeah, that's it. Thank you so much. Stay safe out there, and we'll talk to you another time. I appreciate it. It's Dr. Shadi Ireifej here, Vet Triage, signing off. Thank you again, everybody. Thank you.